Oh yeah, on the phone.
All right. This is my mini mental state examination for my patient with depression with a cognitive impairment. So I am Cameron Hagan, I'm a PA student doing your mini mental state exam today. Can I have you verify your full name and date of birth for me?
Sure, Jasmine Duel, 7/25/2000.
Okay. And then what brings you in today?
Yeah, it's just been hard to focus. I've just been feeling a little bit low. I'm just forgetting things. I just feel a little off.
Okay. I appreciate you sharing that. I'd like to do a brief mental assessment today called the mini mental state exam. And it helps me understand how your memory and thinking are doing. Is that okay?
Mm-hmm.
All right, so the first part begins with something called orientation, assessing your orientation. So first, can I have you tell me what day it is?
May 20-something.
Okay. Do you know what day of the week it is?
Maybe Tuesday.
Okay. And do you know where we are right now?
A clinic, your office.
And do you know the name of the town we're in?
Richardson.
Okay, moving on to registration. I'm going to say 3 words, and then I want you to repeat them after me, and then try to remember them for a future time. Okay, say apple, table, and penny.
Apple, table, penny.
Perfect. So we're coming back to those. Now for your attention and calculation, can you count backwards from 100 for me? By sevens.
100, 93, 86, 74.
Remember those 3 words I asked you to recall earlier? Can you recall those for me?
Oh, apple, coin, no, spoon. I can't remember.
Okay. Moving on to language. So I'm going to show you a pen. Can you tell me what this is?
A pen.
Okay. And this?
A watch.
Yep. And now repeat after me. No ifs, ands, or buts.
No ifs, ands, or buts.
Okay, now can you follow this instruction? Take this paper in your right hand, fold it in half, and put it on the couch.
Like this?
Yep. Okay. Now please read what it says and then do what it says. All right, and then now write a sentence for me. Anything you'd like. All right, and now copy this design.
Did you want to show this?
Great. All right, Miss Jasmine, so that's all for today. So this assessment kind of helped give me a better picture of what's going on. You did well, and so we're gonna talk more about how to support both your mood and your memory. I just wanted to remind you you're not alone in this, okay?
Thank you. I appreciate you for listening.
All right, for the discussion part of this assignment, for the analyzation of the MMSC results, I think it's important to consider how gender identity, cultural norms, cultural background, social factors, and just all like the different factors of the social determinants of health could influence your score. Because the MMSC is a standardized test, doesn't always account for differences in things like language, education, culture. So if language weren't her first language, in this case obviously it was, but in the future if English wasn't the first language of the patients, performance might be related to that. It wouldn't necessarily suggest cognitive decline like it did in this like mock interview. For my patient specifically, being an Indian woman, she might face stressors that don't always come up on a cognitive screen, like family expectations, pressure on academics or career, which she did talk a lot about, or we had a side conversation about that. And then stigma surrounding mental health is obviously a really big one in every culture, but especially in the Indian culture, she was telling me. For treatment plan, we were discussing having it, of course, center around her culture and preferences as much as possible. So I recommended individual therapy, like a provider who specifically has experience with South Asian patients or young adults navigating bicultural identities. So if she's open to it, something like that would be great for both the depression and cognitive fog. We also talked a lot about grounding, so things like journaling, guided meditation, breathwork, yoga, which she said she already does some of that, but just emphasizing how important it is for well-being and mental well-being in general. We talked about how depression can sometimes feel like your brain's in a fog or forgetting things or feeling scattered, and how doing these things to help our brains as much as we can will help hopefully that fog that she's experiencing. I also talked about wanting to screen her for other health concerns like poor sleep, anxiety, or even like lifestyle habits like nutrition, screen time, outdoor time. Talked about how that affects cognition. We talked about building a better sleep routine, nutrition, meal planning, exercise, whether that be going to gym or group fitness classes. She says she really likes to walk her dog a couple miles a day. So just emphasized how important that was. And then I also asked if she prefers to talk about things like this with family or not. She says she likes to keep things like this private, so that wasn't necessarily a tool I guess we can use for this patient's case, but in future cases, using family, friends, partners, mentors, professors, colleagues, things like that can really be helpful. During the encounter, I felt like I tried to be as clear and empathetic and judgmental as possible. It was a little tricky since it's a mock interview, but I tried to emulate that as much as possible. Tried to give her time to process and speak, and validate her experiences, since mental health can carry such a big stigma. Looking back, I think one thing I could have done better on is asking, like explicitly asking about how her cultural background might shape her views on care, like if she's comfortable with more of like a therapy route versus like a medication route, or if she wants to avoid medications, and things like the family involvement, which she did clarify that she kind of likes to keep things private in that nature. But in the future, I'd want to make sure I kind of open up that door earlier, so her voice drives the care plan from the start. We don't have to spend time backtracking or clarifying as much. But yeah, that was my MMSC discussion analyzation.